India Mental Health Alliance recognizes how critical it is to set up forums, convenings, and opportunities for cross-sectoral conversation, bringing people with lived experience and from communities together with those across the development sector, organizations working in women and child, education, livelihood, together with mental health grassroots organizations, is really what will help us conceptualize what an ecosystem of care might look like that covers a preventative community-based approach and a community-led approach in a collaborative way, working with mental health professionals to be able to build capacity so that we're able to truly build the right services, build the right care models in community, and be able to empower the lives and contexts of people across their schools, colleges, and workplaces.
To expand the idea of mental health, to take it out from the clinic-based, expert-driven, biomedical model that we've been following for so many years. Mental health resides in every space in the community, in every aspect of life. And if we keep waiting for things to eventually lead to a crisis in the form of acute mental ill health, then we are losing the plot. And if we are able to engage with the stakeholders at various stages, maybe parents, teachers, policymakers, employers, then the whole model becomes what we call a developmental model.
Our inner state of being, which is our mental health, directly impacts every intersection and every part of our quality of life and how we show up in the world. And if we're able to open this up as a definition, then I do think that the way we look at care or treatment or management of mental health, mental illness, and the impact of it on everyone around us, I think that changes.
We realize that this is an area that does need a lot of help. It needs long-term patient capital that can go towards systemic changes for the country. We need people across sectors, all fields to come together to solve this problem for India so that we can create a happier society.
The India Mental Health Alliance exists to ensure that we can play a role in strengthening the ecosystem, working on capacity building programs with communities and by communities, and also with mental health professionals, and put in place programs co-designed with them that are able to help them overcome skill gaps or quality gaps, with the intention to say, how do we mainstream mental health as a development issue? So can we bring together organizations that work on climate, that work on gender, that work on livelihoods, that work on education, along with organizations that already work on mental health? Can we enable co-creation of knowledge? Can we enable cross-sectoral research? And can we look at opportunities to bring together these different organizations so that they're able to identify joint priorities, collaboration and opportunities?
Previously, all our philanthropy had been in the space of education, but we had a personal lived experience with our elder daughter, and that sort of brought our attention to the space of mental health. We would really love to see many other philanthropists come together to work towards this movement, to create a capacity, to create alliances, and to bring this sector together to be able to support the ecosystem of mental health in this country.